Of course, there's also confusion surrounding screenings for prostate cancer. A government task force is recommending that men not get a PSA test, prostate-specific antigen test at all. But 7 News reporter Doug Shepman found some doctors are choosing to ignore that recommendation.
I think we're saving lives.
For 2 decades, Danny Tomlinson has had an annual PSA screening, which is a blood test measuring the amount of a specific protein created by the prostate. Then, at 61 years old,
my PSA had about doubled, and then 6 months later it had quadrupled. And we did a second biopsy, and that one came back positive for prostate cancer.
But that same PSA screening is under fire by the U.S. Preventive Services Task Force, which has issued a draft recommendation against PSA testing for all men who do not have symptoms that are highly suspicious for prostate cancer. The reason? A high false positive rate of up to 80%, which can lead to unnecessary biopsies and even therapies that can have adverse side effects.
You have to screen somewhere around 1,400 men in order to save one life. But, you know, everybody's definition of whether that's beneficial or not is different.
Dr. Mark Jones of the Urology Center of Colorado says the PSA test is imperfect. But according to guidelines established by the American Urological Association, he believes men should still get a baseline PSA screening at age 40 and follow-up screenings based upon risk.
It is my belief that probably men under the age of 75 still will benefit from PSA-based screening, with the caveat that they need to have at least a 10-year life expectancy.
He says the benefits of early detection outweigh the risks, and Danny agrees.
If it can prolong your life and your quality of life, it's very much worthwhile.
Doug Shepman, 7 News.
Now, the U.S. Preventive Services Task Force is taking public input on its preliminary recommendation through November the 8th. We've posted a link on thedenverchannel.com that will take you to the full report and the comment page. Just click on the big red TV button.